Charito and Lisa, all for your really interesting talks. So I'm going to open the floor to questions now. We've already had a few come through. The first one came from Diane Coppola and was for Dr. New. Can you clarify how policy was defined in the Westminster Plan? Thanks.
Thanks for that question. I don't know if I can speak to exactly how it was defined in that plan, but I imagine it would be as in general in OCD documents, essentially a stated intention for action or principle for action. So that would ultimately direct staff to develop strategies or ways to implement what's stated in the policy. I'm hoping that's answering your question, or if there was something more specific.
Great. So I'll just remind you that you can post your questions in the chat box. And I also wanted to point out that in the chat box, Dr. Karen Lee has been sharing some interesting resources that you guys are welcome to check out and has given some links and things there. So we had another question come in, which I think is also for Dr. New, and it was related to examples of social equity policies. Do you have any that you could share?
I don't have any off the top of my head. Charito or Jennifer, do you have any? I think
what was
an example of a social equity policy.
Go ahead, Lisa. There's a bit of a delay. Go ahead, Lisa.
No, it's fine.
I mean, spatial equity is certainly something that came up within the Abbotsford Plan, where we saw that some residents had better access to green space, other residents had better access to cycling facilities. We also discovered through our work that, if you look at, for example, just look at residential density, so household density, it often obscures a fuller picture of, different cultural household dynamics. So in Abbotsford, for example, there is a large Indo-Canadian community, and we looked at residential density. We saw a very different picture than we looked at population density, because areas with lower residential density, single detached homes, were actually home to extended families and a lot of people. So ensuring that we were doing an analysis that was capturing some of those nuances and designing policies around that became very important to ensuring that different cultural groups were treated equitably and that their policy needs were being met.
Thanks, Jennifer. And yeah, so following on that, I think similarly, a policy, for instance, to specifically address, so one of the examples that I gave was around the energy efficiency measures. So, a policy around targeting their energy efficiency upgrades to renters and low-income households could be considered a social equity policy. I think that that would be one very targeted application. You can probably also kind of do an umbrella social equity policy and look across the different realms of whatever or plan you're looking at to consider the social equity implications. So that would probably be a couple of different ways of approaching that.
Great, thanks to all of you. So we've had a question come in of somebody wanting to know a little bit more about the healthy built environment and vulnerable populations. So I actually just wanted to take the time to point you guys to a resource that we have at the NCCDH, and it's on environmental racism. And we've just added the link there. That one's for Sandy Himmel. The link is in the chat box. I'm not sure if any of our speakers have anything that they want to say about vulnerable populations in the healthy built environment. Okay, so sorry, go ahead.
I mean, there's some really interesting work being done looking at food deserts and recognizing that often those food deserts, those places where you don't have access to fresh foods, are often in areas where you have, lower income residents. And in many cities, including across the prairies, these are often neighborhoods that where you have higher proportion of Indigenous people. So Indigenous peoples aren't having the same sort of access to fresh and healthy foods as others. There's also some really interesting work around the intersection of gender and urban design, and recognizing that women on average engage with cities and are engaged by cities differently than are men on average in terms of transportation behaviors, safe spaces, et cetera. So many different intersectionalities and dimensions to explore when we think about, maybe the word vulnerable populations, but in different groups of people within the city.
In vulnerable populations, vulnerability in general is a really, really important aspect of climate adaptation and really climate action in general. And it is one of the main roles, I think, for public health engagement in that work is to be to be really active in drawing out what the implications are for the different vulnerable or subpopulations in a particular geography, because we know that climate change will disproportionately affect those populations. And so that's another area that I think is an emerging field of practice, and it really overlaps with the HBE work, but has its own kind of particular nuances.
Great, thanks. So we have another question now from Karen Lee about maybe if the presenters can comment or share their thoughts on the idea of adding a healthy buildings component to the framework. So what she's saying is that we spend most of our time in buildings, and this could also help us improve affordable housing developments and buildings. So any thoughts there?
This is Charito. I've had a few really great conversations with Sonia Yanisek, who's part of our Lower Mainland Facilities Management Group and on the Built Environment Alliance Steering Committee, and about the importance of looking internally within our health facilities around what is a healthy built environment for our health facilities internally and externally. And they've been using the toolkit to sort of what the environmental energy efficiency guidelines could be and sustainability guidelines could be in relation to the toolkit planning principles. So I think this is an evolving conversation, and I believe that resource has been finalized now, so that's something that we could share if people are interested in that.
Fantastic. And Charito, if you want, you can just, if you have a link to that resource, you can put it in the chat box for people if you like.
Okay.
If they can see it there. We've had some people add some resources related to health equity and the built environment for vulnerable populations. So if people check the chat box, Karen Rideout has added a resource also from the BC CDC on just that topic, if you want to check that out. So we have another, I don't know if it's a question or a comment from Karen Lee, but she's saying vulnerable populations health equity, raise health standards in the built environment is a health equity measure because you don't have to use money to buy a healthier environment. And so she is suggesting people check out the WHO Healthy Cities report for that. So coming to another question, we've had somebody ask, has anyone had success in building a checklist or health impact assessment component into the work of planning departments at the regional or municipal level to integrate health equity considerations in daily and ongoing work of planners?
The City of Vancouver, now I don't think it's a checklist, but they do have an award-winning healthy city strategy that they have in place where they draw these links, and it's supposed to, just like many of the other plans around sustainability and green city, intended to permeate all facets of their decision-making, from policy making to capital work to engagement, to asset management. So I know that's something that it's a lens through which they do their work continually. Whether it's actually checklists is a bit of a question mark. I don't know, Lisa or Charito, are you familiar with whether there's a checklist component to the City of Vancouver's Healthy City strategy?
So in general, we've tried to avoid a checklist approach because nuances can get lost in that when you kind of have just a straight yes or no, they're including this or they're not. We have actually worked with the Regional Transportation Authority here, TransLink, on their, actually quite a few years ago now, on a regional transportation strategy. And they actually did a strategic health impact assessment of that strategy, which included basically the different HPE principles and health outcomes associated with those, as well as equity. So that was something that was kind of a collaboration between the health sector and the Transportation Authority. They have continued to have interest in using health impact assessment as a tool and for their planning processes going forward.
Great, thank you guys for that. So there's still lots of resources being shared back and forth in the chat box, so I'd encourage you to check that out. I will collect all the resources shared, and when we send out an email with a link to our evaluation survey, we can share that with you guys then if you don't want to keep track of all the resources that are being shared right now. So we have another question that's just come in from Simone Santel, and she's asking, how do we increase public awareness of the importance of the built environment for long-term health and well-being? And do any of our presenters have examples of successful information or education campaigns or collaborations with the media to bring these issues into the public eye?
That's such a good question.
Yeah, I heard of anything, but I definitely agree that would be great to have that public perception increased. I know that from past conversations that sometimes public misperceptions about some planning processes and goals can be a barrier, and being able to show, I mean, I think that the work that Jennifer showed about those engagement strategies and showing this is one option for a plan moving forward based on a population size increase, this is what it could look like, these are the benefits to the communities. Those kinds of things to make it understandable to the general public, I think are super appealing, and also people just like to be engaged, so which also has health outcomes just because of that. So yeah, I definitely would be interested if anyone else has heard of anything.
Go ahead, Lisa.
Oh, okay. The Healthy Built Environment staff do, I think one of the ways in which the health sector can support actually in the public engagement side and bringing forward the health implications and considerations of the different planning strategies. So, you know, being part of presentations or workshops, town halls, and that's something that I think we do on the ground. To my knowledge, there isn't an overarching long-term strategy around this in this region, and that's been identified as a gap. It has come up most recently when I don't know if people are aware, but there was a commission on the potential for mobility pricing for the region, and when that came out, the health sector was asked to kind of come out and support it, but there hadn't been any engagement actually prior to that, so it was difficult to do so. A few years ago when there was a transportation referendum, a referendum basically on a sales tax to support transportation and public transit investments, the health sector actually was very much engaged, and we did engage in we couldn't work within the health authorities, and so we were working kind of in our roles as independent medical health officers, basically to support the plebiscite and to support transit investment. And so that we did actually do a media campaign around that, but it hasn't continued, and I think there is a gap.
I think there's a tremendous opportunity within local governments, as the body that is at the front lines working with communities on planning or plans at all scales, whether we're talking about transit plans or neighborhood plans or official community plans. In all of those exercises, there's always or typically a tremendous amount of public engagement that happens, and of course, engagement is a two-way conversation. So there's information in, we're seeking input from communities around their priorities and aspirations, but there's also information out and an opportunity for education. And, the Abbotsford example I spoke to, we had 8,000 distinct engagements over the life of that process. So there was a lot of mutual learning that was happening there. So I would say that, within city halls, there's already so much engagement happening. So seeding those engagement exercises with healthy built environment information and links is just a tremendous opportunity, and some municipalities are doing it.
Thanks, fantastic. So again, I just want to point to everybody to the chat box. There's some great resources being shared in this exact area. There's some links to some new videos from Ottawa Public Health that are showing they're made for the public to show how community is planned to impact health, and they're suggesting to the community to engage with local politicians and planning departments to support planning that supports health. So some good resources in this area. We've had somebody in the chat box ask if anybody could point them to resources around public awareness that are being created in support of the National Housing Strategy. So if anybody is aware of those, please share them. I just want to share that we at the NCCDH have a reading list coming out soon related to housing as a health equity and as a determinant of health, and some other related resources related to the Rent Safe research program and some of their findings. So that's something to watch for from us later this month. So I don't have any. We have probably time for one quick question if somebody wants to fire one off in the chat box now. Otherwise, I will start to wrap. I'll just give a couple more seconds for that. So I don't see anything coming, so I just want to say thank you to everyone. Linked here on your screen is a link to our evaluation survey, and we'll also send an email out later with a link to this. So we really appreciate your feedback. It helps us do better and to serve our audiences better, so please take the time to fill that out. As I said, I will also share links to the resources that have been shared in the email when I send that out. If you want to know more about the NCCDH and our work, we suggest that you check out our website. It has information about our workshops and events. It has our resource library where we populate resources related to the social determinants of health and health equity, including healthy built environment, as well as our health equity clicks community where you can engage with other public health practitioners with an interest in this area. We have a webinar coming up two webinars coming up in September. The first one is about participatory practice and health promotion in Canada, and there's a link there to register to that. And then later in September, we have another webinar coming up related to systemic approaches to addressing anti-Indigenous racism. So certainly those would be very interesting topics. So you can check out our website to register for those. And if you need to contact us, you can find our information right here on the screen. Thank you once again to Jennifer, Lisa, and Charito. I really appreciate the expertise that you brought to this conversation today, and I thank you all for attending. So please feel free to reach out if you have any questions for us. You will be able to download this or view this presentation, rather, on our YouTube channel.